Hello, good afternoon, everyone. Today, I'm very glad that we have many panels here. Many people are here in the live. So, greetings of the day. So, we will be starting with the autism awareness program very soon. We have on panel Mr. Setu, Dr. Setu Warrior and Mrs. Preeti Dikshit. So, I'll just give you a short description and a short brief introduction about what is this program about. So this will give you an idea of what we are going through and what we are going to head on actually. So I'll start with some kind of few words saying a beautiful lines where Dr. Setu area have said me long to I think when I met him in the first meeting. So I just want to start with that words and hand over the session to him actually. So it was actually about an autism, and it was about how the people are treating the autistic people in a different manner, how the things are not working out properly, but the people are not accepting the kind of autistic people. So this was a topic we had a discussion, and we had a lot of talk with him regarding this actually. And it was very beautiful that to know about Dr. Setu Warrior about this kind of meeting, and it was a very I can say it is a very kind of marvelous eye-opening to me, stating about autism, how it was performed, or else how it was taken from UK, United Kingdom. So how he is with practicing the things all there also. So he sent me a story. It was actually beautifully written by someone else. Actually, I'm not familiar with these people. So he sent me a poem or else a kind of a short description, which describes a lot about the beauty of autistic people. You can see. So it was about a family planning a vacation to Rome, actually, to visit Rome, and the family was all ready. They packed everything, and they knows like they took the two guides, everything. It was complete itinerary was completely planned, and they were very happy to join the beauty to know the beauty of Rome, and they was like ready on the day, and they took the luggage and they went to airport where they boarded the flight, and everything was fine. They are getting down in Rome. They were very happy to see the place. Suddenly, there is an announcement from the after landing. There is an announcement from the air hostess saying that we have landed in Paris. So this kind of reaction when the parent was like, what is this Paris about? What is this about? We took the ticket to Rome and we are landing in Paris. And this was a question they took up in mind, and they was like, mom, this flight is for the Paris actually, the hostess explained. So they said, no, I took the ticket and my complete itinerary of planning is towards Rome, and I don't know any places in Paris. So this was a planner claimed that they don't know any places. Also, they don't want to stay here. They want to get back to Rome, and where the air hostess said that we don't have a flight anymore to Rome actually from here now, so you need to stay in Paris for a while. So the parent was very confused. And it was very hard to accept it, but they were forced to stay. And they brought what they did is they came out of airport and they brought some guidebooks, and what is this place about, what is this Paris about. They don't know the beauty of Paris, so they started studying about the beauty of Paris. They understood, okay, it's a great place, and it is actually they came to know what is the beauty of Paris later on actually. So one important thing I just need to mention you all with this kind of thing is they were not they were actually, the important thing is about they are not in a bad place actually. They're in good place, but still they thought it is a bad place, or else it is not fit for them to come there actually. So it is actually the perspective things matters most of the times actually, where we are planning many kind of things in the early sessions, that saying that we need to go there, or else we need to get a child, and he should be very perfect, he should become a doctor, or else should become an engineer, or else many kind of things are there actually, where the families are planning every kind of each and every kind of moments. Nowadays we are very fast forward to plan each and every kind of things actually. So, where I want to point out, the story gave me a beautiful eye opening saying that where the Paris is also having a beauty, They could also enjoy the beauty of Paris, but they were in a despair to like, why I'm here, or else why I'm supposed to be coming here. I took a proper identity to Rome, and why the people are forced me to stay here. So this is a kind of reaction when they have a baby, and the baby is somewhere kind of an autistic, and it is very difficult. It is very difficult to accept the things in society. So we're in India and all over the world, not only in India, all over the world, the autism is something where the people are keeping aside, and they are meant to be something very different, or else very kind of different characters and all. So where we want to bring up some eye kind of an eye opening things, where there are a lot of people who is still autistic, and bringing up some massive changes, you can tell, where the world is changing because of them. Sometimes you can say, like we can take an example of Elon Musk, or else many kind of characters. You can go through many people who is autistic, but they have developed a lot of things actually. So it is actually a training kind of thing, where they need to be given, most of the things should be trained in that way. So and I just give you a short note what is about this seminar, and who will be joining this seminar will be Setu Warrior, Dr. Setu Warrior, and Apriti Dikshit. So I'll just give an idea about who is Dr. Setu Warrior, and many of them seeing the life must know that he's already knows about him. But still, I'll give him an introduction how he is, and where he comes from actually. So last 25 years, I can say he was in UK, United Kingdom, for last 25 years. And he is a fellow of Royal College of Pediatrics, served as a chief examiner for MRCH in various centers all over the world, where he took up, he went to a lot of places like Abu Dhabi, then Singapore, Malaysia, a lot of places he have went through for an examination purpose. And he has served in various committees governing the management of neurodevelopmental condition, and also participated in various projects related to autism, ADHD, cerebral palsy, including clinical traits. So it's very important that he is much experienced in the kind of thing what he's doing, and it is very pleasure to have him here. And I need to say that he has established serving for he has made an establishment for children with disability in various medical institutions in United Kingdom too, including the first transition clinic for young people with ADHD also. So we are having a warm and a kind of extraordinary, or also I can say extraordinary person here in the life. So I'll be getting connected with him. So he'll be having a word about what is this program about. He will be leading the complete idea about this program. Okay, so let's welcome Dr. Setu Wadir. He'll be in a minute. Actually, he'll be joining in a minute.
Hello. Good afternoon to all of you. It's indeed a rare pleasure to be amidst people who want to know about autism, and also parents who very well know about autism but would like to perhaps refresh their memory about what it was when they first got the diagnosis, and how they navigated their way through the difficult terrains of the life trajectory of a young person, or with autism, or a child with autism. One should remember that autism is actually is a normal difference in a person's behavior. There have been few, until a couple of decades, it was considered as a disorder, a disease, or a curse or something that one had to be rather concerned about. But there's been a huge paradigm shift as far as I'm concerned in my own way of thinking, and also in what the world in the field of disability, childhood disability, has accepted as a novel way of looking at many of these neurodiverse conditions, as they're called. So even for even when I started my training long time ago, long time ago in India, I found the subject of autism quite mysterious because it used to happen in a very mysterious way, and one wouldn't understand what is happening inside the child's head. And there were times when there were situations where I have felt quite sad about the way how these children were being spoken about. I do not know if how many of you know Malayalam. The word used was pottan. Pottan means someone who is who cannot speak, who cannot understand what is being conveyed to them. And that was quite a painful episode for me. I distinctly remember standing up to a parent and saying, "How could you call your son a pottan?" And well, obviously things did go down well and they left in a huff. But that's the way how it was being addressed those days. But my whole view has changed in the sense I still remain very passionate about treating young people with autism, ADHD, and cerebral palsy, any disability for that matter, with dignity and the respect that they deserve, because they also have a soul inside them. They also are a part of humanity. All of them are contributing to the society in some way or the other, provided we give them a chance. This is where the difference between the medical model and the social model, as I and Preeti were discussing a few days ago, has evolved. In the sense, medical model is what we doctors unfortunately adopt by ascribing a diagnosis to a child or to a young person. Well, now even many adults are getting diagnosed with autism, and then we list innumerable uh, deficits in them, and then try to make them change, make the person change towards a path towards normalcy, as if expecting them to change. But one thing I must say, autistic children are God children. They are the people who thoughts cannot be changed. They come to challenge you. The only kind of the cohort of human race that does not change its way of thinking. Sometimes for the worse, sometimes for the good. But unlike so-called normal people out there who can be very easily influenced by even social media like WhatsApp, where you can see this polarization where everyone is trying to establish their point and standing stuck in a way of thinking. One cannot do that with a child who has got autism or with a young person who has got autism because they stick to the guns and you just cannot change their way of thinking by either attracting them with bribes or whatever. Anyway, that's one thing I have always pondered about because how could someone stick to the gun so beautifully and at the same time be productive in their life? See, that is what we should be aiming towards. And most of my management strategies, which I might get a time to talk about, will be around how we utilize the stuff, the matters that are considered as difficult and use them effectively so that life for a child with these conditions becomes tolerable, manageable, and even maybe productive. Otherwise, what I have noticed is that some of the adult patients who have got a diagnosis of autism quite late in their life have invariably come back to me and have spoken about the innumerable barriers and hurdles that they had to go across, with each one of them causing a lot of anxiety and a lot of shame and a lot of guilt. I say shame and guilt are the two main emotions that leaves a solid scar, and that scar actually even influences the way how you look at the world and how you interact with it. We all, if you were to look back into your childhood, we all would have had an experience where one of the teachers or one of your family members has spoken about you in a very derogatory manner in front of others and has made you feel that shame, for something that you know very well that I have this deficit, I have this difficulty, but it has been brought out to light when I do not want it to be exposed. And you can imagine that shame, how long it lasts. It lasts all your life because you're carrying that feeling that I'm not good enough. And that carries on to the next generation because there are now transgenerational, uh, uh, there are inheritance patterns that are coming up just because of what we endured as a result of stressful, toxic stress in the environment that we're brought in. Now, the other point, like I was mentioning, is that guilt is again sometimes you're made to feel that you're responsible for something that has gone wrong in their life. And that guilt is more often experienced by young children than young people and adults because they have this formative mind. And in the formative mind, there's a lot of magical thinking because we cultivate in them a way of thinking where there is a fairy godmother, there is a knight in a shining armor on a white steed coming to save your life, or there is a god sitting up there and weighing pros and cons and deciding whether you need to be punished or you need to be rewarded. In such a situation when things don't go well, or maybe say, for example, if parents split, very often they take it upon themselves. They think, I am the root cause for this. So that guilt lasts all their life. So this guilt and this shame is what is the root cause for the future formulation of our final personality as an adult, which is such a shame because many of these things are not really caused by you. But that's the way how it is. If we catch them young and find that these things can be weeded out of these young people, and we give them an opportunity to think differently and to think with an open mind and put that negative bias behind and move on in life, very often, even in so called normal children, many of these difficulties that they encounter in adult life can be circumvented. So let's start with a little bit of autism, what it is, and how it progresses. So, first of all, I would like to oh my God. First slide. So I walk straight to the last slide. Yeah. So let me talk a little bit about paradigm shift. See, autism has. You want to press it? Yeah. Is it? It's on the screen. Okay. Sorry. I have my glamorous assistants helping me in making this show more presentable. I'm not a computer wizard, and he is. I come to know about this young man only a month ago, and I realized what a fascinating personality he is, who has left his corporate trajectory in his life and has started to work in this field of disability purely because he was inspired by some kids who were struggling. That is something I really admire in any person at such a young age to do something. So, Sinan, hands. Okay, let's join hands together to actually praise this person's wonderful way of thinking. Right? Shall we start?
Should we make it in halfway?
Hmm?
So you can
No.
just go on. Make it in halfway.
Okay. Okay. If you can do it from there, that'll be good. Hmm? Okay. Shall I carry on?
Yeah.
Okay. So first of all, as we know that autism has come with several names. It's not just one single name. We know about the core autism, the Kanner syndrome, and on the other hand, you have the Asperger syndrome, where we also call them by the name high functioning autism. But actually, even if they come in different baskets with different names, different brands, basically there are certain deficits or difficulties that they endure, which are very common in all these conditions. So that is one thing that we need to understand. Although we have different names in the past, say 20 years ago, since 2014, since DSM-5 has come out, there has been a very clear understanding that we do not box them into different categories, but we box them all into one single category called autism spectrum disorder. As simple as that. The reason being, there's been a lot of confusion in various studies in the past and various ways how people were describing these conditions to the extent that it became very difficult for uh, transmitting information from one side to the other, and also There were also intra-observer differences in the way if- how it was understood. So if I have autism, I couldn't understand whether I have Asperger's or I have the Tanner's, because there was so much of uh, difficulties in understanding the nitty-gritty of how a diagnosis was made. Secondly, there were also difficulties in the way how DSM-4 spread out its DSM-4 is the Bible that we hold onto while we are making a diagnosis of any condition internationally. There's also ICD, but DSM-4 and DSM-5 are the generally commoner ones that we tend to use. And DSM-5 has made it quite simple, which is what I'll put there, which is the point I put the last one at the bottom. Now we need to understand that one of the main paradigm shift has been the way how we address this condition. We do not address it as a disorder anymore. We see it as a neurodiversity. See, I have twin girls, and right in my home, the environment was the same, the encouragement was the same, the parents are the same, but we could see how diverse they were in the way how they caught up with their milestones and how they interacted with their internal environment and external environment and how they responded to changes in the environment as they grew older. And now they've grown into lovely, two totally different, beautiful human beings who are contributing to the society in their own ways. And I'm really proud to say that because I do not think we as parents ever attempted to change the way how they thought or the way how they wanted to carry on with their life. Of course, like any parents, we did have our own little differences of opinion, but because we did not in any way try to influence their way of thinking, there have been times when they have questioned my own way of thinking now as an adult, and I have learned quite a lot about myself by listening to them. So that's something I think is an off product of not attempting to uh, address or not attempting to influence the way they think. So this is one thing that has happened in the last from 2013, I guess, about a decade ago. It was decided that we do not call these conditions or just human conditions as a disorder, but rather as a diversity. So even in my home, as I said, there was neurodiversity, and I knew that. So why not for the people out there who are walking around in the community with lugging this label of disability just because we call them, just because we doctors or professionals working in the field have labeled them as having a disorder. So that's one thing that has come, and it's a refreshing change for the simple reason that people are now accepting people as they are. In these days when one cannot really define what is normal, I do not think we should also define many of these differences in the way how people think or they want to live as a disorder. So that's one thing that has happened, and it is quite laudable, which is quite encouraging that people are starting to think like that. We also, I just want to make a mention about the medical model versus the social model that's being considered now. This move from a disorder to diversity itself is actually embracing the social model. In the past, when someone was given a diagnosis of autism, what they were, if they were of the capacity of having a higher level of cognitive functioning or a higher level of speech and language functioning, very often they used to think, I have been branded with a condition which has got so many facets of deficits in me. They were never made to think about the positives that they have. Many of these deficits that have been branded and sort of stamped upon them actually are strengths as far as I'm concerned. If someone has got a rigid way of thinking and they can focus on a task for a longer period, oh my God, I can't do that. I'm sure many of you can't do that either. Like fix your mind on a task and carry on to its success. Not many of us can do that. Some of us still can do that, whether you have a brand or label or anything. But what disables them is that diagnosis. They are made to think that they are not good enough. They have got so many deficits that makes them lesser than the other beings, but never has their higher level of cognition or higher level of communication being taken into consideration. And they're made to feel different, and they are marginalized and often uh, kept apart from the society, mainstream society, often relegated to some institution, which is very sad. But things are moving. Now, every person has got the right to live in an environment and thrive with all the benefits that all the people out there are accessing. And that's one thing that really impresses me. So let's have a quick look at what it means by autism, because this is something that has been much confused and also has been much debated. And very often one finds that some of the discussions around autism are purely Chinese whispers, based on Chinese whispers, or based on old wives' tales, or completely based on their own imagination. When I came to Kerala in November and I started a clinic just one day a week, well, slowly I had to go to 1.5 weeks because there were some sessions that needed follow up. So within 6 weeks, you might be surprised to hear that I made 13 diagnoses in just 6 weeks. And there was one parent I distinctly remember who started to sob at the end of it when I spelled out the diagnosis after having a very mutual, uh, very conducive discussion around the difficulties that the child had. And once I gave her diagnosis, she started crying. And I was actually taken aback because I wondered if the diagnosis had made her feel unhappy. But on the other hand, she said the sense of relief I felt was tremendous. And then I looked at the previous notes made by different professionals, and it appeared like there was always an undercurrent of a suspicion of autism, but never has that been brought out. So here's a mom who has gone from pillar to post and has gone through several barriers of anxiety and feeling a failure about herself, that she's not a good enough mother and not being able to cater to her child's need. Such a mother has been sitting in front of me and she's saying that she is relieved because she's had a diagnosis, which is quite sad because this is something that the least that we can offer a parent, for the simple reason that that helps them to cope with the uncertainty of the diagnosis and also make plans for the future. Without these simple resources that or support that we could give, I think parents are also left adrift without any support and they do not know where to go from here. So there are two sides to autism, as has been currently described by DSM-5. On one side, you have these social communication challenges, and on the other side, you have this, I would call it perseverance of sameness, in the manner in which they remain restricted in the way how they look at things or interest, and how they access repetitive patterns of behavior which are quite inflexible, and they find it difficult to change. And most importantly, they find that this whole process of being so restricted and being rigid in the way that they think, and the difficulties in changes affecting their daily life, which is what is observed by other people as behavioral problems, because they are trying very hard to normalize these children. And on the other hand, now currently, though this was always addressed as a part of autism, which is sensory processing difficulties, where either the stimuli that hits them is too sharp, too intolerable, or too difficult to endure, or they find some of the sensory stimuli are not enough and they are trying to reach out very hard. But surprisingly, if someone has attention deficit hyperactivity disorder as well, along with ASD, it's a very interesting topic as far as I'm concerned. And most of my patients had actually the dual diagnosis of autism and ADHD, which was quite. It's not coming. Yeah, you can just continue. Okay. So what I found interesting was when you are so stimuli defensive because of the condition of the autism. And if you've got ADHD, your stimuli, you're seeking stimuli. So it becomes an incongruous combination where, on one hand, your body is desperately trying to reach out for stimuli, and on the other hand, you become very defensive to many of the stimuli coming your way. So, if there's a child who wants to be hugged, and when the hug is given, you see they kind of cringe and they wipe off. If you've given them a kiss, they wipe it off immediately. It is quite incongruous in the manner how the personality switches from one that is seeking touch to one that shrinks or shirks from any form of touch. That is perhaps the main reason why very often autism diagnosis gets submerged in the bigger demonstrative diagnosis of ADHD. So that's one thing one needs to keep an eye upon. When someone has got a condition where they show this kind of a difference in the manner in which they react to stimuli, often it is ADHD and autism. I might, if I have time, I might try to differentiate between the two conditions if there's time. Okay. And now I want to talk a little bit about what it means about this socio communication difficulties. So, to make a diagnosis of autism, one has to have three of these domains present. In the sense, a child with autism has to have socio communication difficulties. And of these rigid, repetitive, inflexible behavior patterns, you need to have just two of them. That's the current criteria. It's not something that I've created, but that's the criteria that DSM-5 has floated. So one has to have three plus two to make a diagnosis of autism. So what are the most essential criteria or the domains that is looked to consider autism? Number one is the need for socio emotional reciprocity. We are human beings, we are a social being, and we relate to humanity in a way in which we have to be a part of the community or a society by mingling with others. One cannot exist in isolation, in silos. If one does that, it means that there is some form of alienation going on with him, himself, or with the society around him, or with the whole world, with the environment at large. So, if you look at these three domains, it's clearly what we use as a daily interpersonal skill. So, this includes both interaction and communication. One thing that I need to point out is that the verbal skills has been excluded. Previously, that used to be one of the major criteria to make a diagnosis of autism. You have had to have delay in speech or a deviation in the way how you acquired your language. Now that has been excluded, which is a huge sense of relief for clinicians like me, because we had to depend on speech and language therapists to give us a report. But now it's not that very essential. If you look at these three domains and someone as senior as me, it is very easy for me to pick someone who has got autism and who doesn't have an autism. So if you look at the subdomains, the first one is, I would say, is nonverbal communication. So if you get to see a friend across the road, you wave at him, hi, and the person, if he wants to communicate with you, he might say hi. And then suppose you cross the road and go to them, and you become very animated. Your facial expressions, your gestures, and all suggest that you want to interact with the other person. And from the body language of the other person, if the other person remains flat, no expressions, no body language, no change in the tone of the voice, you know perhaps he doesn't want to talk to you, and you walk away. But you know this is not going far. So even when I have a conversation with parents, when I'm speaking to them, if I see them nodding, if I see them showing some sort of a resonation in the topics in the matters that I'm conveying to them, you can understand from their basic body language and facial expressions and gestures that they want the conversation to go forward. In a person with autism, neither do they transmit these nonverbal communication techniques or resources, tools across, neither do they catch what is transmitted and what is received from your side. So there is a missing link between the transmission and reception of the communicated data. So that's one main thing, as has been depicted in DSM-5. So non-verbal communication is what is given due importance for, not verbal communication. Now, why do we exchange words? or your body language, so as to mainly to, like I said, to establish connections with other people. And the best way to do that is assessing what their social emotions are. Are they happy? In that sense, catch the happiness and feel that happiness and reflect it back to them. And if you go to a room and if you find someone sitting there rather quietly with the head down and the whole body sagging, you understand that this person is perhaps going through a difficult time, is going through a very emotional period. You go across and touch them and say, "Are you okay? Can I help you? How can I help you?" So that's clearly a demonstration of socio-emotional reciprocity. In a social setup, we are exchanging emotions through our body language, through our words. And that social emotional reciprocity sadly is lacking in young people and children with autism. One thing, has been a myth that children and young people with autism do not have sympathy or empathy. It's a myth. It has been proven by functional MRI, which looks at different parts of brain and different functions that they carry. It's now shown that actually empathy and sympathy, the areas reflecting empathy and sympathy, are buzzing with activity at the time when they come face to face with a moment which they feel is going to be emotional. And when they know it's going to be emotional, what they learn to do is move away from it because they can't deal with it. So it's not that they do not have empathy or sympathy, but with time they learn that this is a difficult emotion, a difficult situation, and hence one has to change the way. Okay, one has to change the way in which one reciprocates your feelings. Very often what it ends up is in a state where one avoids such a situation. So we do these things to establish relationships, but the sad thing is that because you do not display a non-verbal body language that expresses solidarity with the other person, neither do you use the right words because you can be socially awkward, and neither do you know how to transmit your emotions or receive emotion from the other side. The signals are often missed, and as a result, very often relationships are not made, neither are they sustained. Even if they make relationships because the other person has been generous and considerate and accepts you the way you are, very often certain awkward statements been have been.
You can continue.
Huh?
You can
I need the next slide.
Okay, 2 minutes.
Yeah. So it's important that we do give this due consideration for that. Definitely, I'm going to have the next one because that is the beginning. Well, so the next one, as you can see on the slide, is rigid, repetitive, inflexible behavioral patterns. And that there are four domains that are examined, of which only you need two. So let's go through each one of them. In our erstwhile Vedic periods, we have discovered that any method of communication or any matter that has got to be conveyed starts with mansa vacha karmana. There's a symbol, there's an imagery that evolves from the mind, and then we put words into it. Say, what is Pune in Tamil Nadu is Pucha in Kerala. It becomes Billy in North India, and it becomes cat in the Western world, and maybe French have a different word. So the same word that depicts the image or the symbol of what evolves in the mind, cat, has a different language. So one has to access that language to communicate that I'm going to talk about this object, and you add a verb to it, and then it becomes an action. So I'm going to chase this cat, or I'm going to hug this cat. That's the word that one has to use. So every single of these domains, if you were to look into the what the thoughts are, what the words are, what the actions are, we can very clearly create a pattern where these domains can be examined in under these three categories again. So first of all, let's talk about the stereotyped and repetitive movement or use of objects or speech. They have very restricted interest, but they also, many of them behave and speak or think in certain patterns it's like being on the same rails over and over again. The thinking pattern is the same, and it carries on and on and on and on in the same. So it's very difficult for them to move from the way how they're thinking to other ways of thinking. Even if they are compelled to do so, they remain rigidly fixed with that thought. And some of the words that they use is quite stereotypic. Repeatedly, they keep on saying the same word, and sometimes that can cause a lot of, we call it ad nauseum, when you're listening to certain words over and over. And there's one mom who said, I almost feel like vomiting hearing the, my daughter say the same word over and over again. But that's because they need to do that. Apparently, it forms some form of a stimming behavior in them. So even this stereotypic movements of walking on the toes, or flapping your hands, or holding an object close to your eye and looking at its movement, because they're fascinated by movements. I've heard parents saying that I've heard parents saying that there are uh, children who love washing their hands repeatedly. But what I've observed is it's not that they are watching it's not that they're enjoying the feel of the water in their hands, but it's the flow of the water that drops down, or it stops when they switch off the tap. And the other funny thing is that you must have also seen them sitting in front of a dishwasher and a washing machine, and continuously watching that for hours, because they like that stereotypic movement and they follow it. So in a way, many of these things, though they are sort of the crossover, many of them are related to stereotypic ways on how in the ways in which they relate to uh, the environment around them. Now, I've said insistence on sameness. I used that word previously, perseverance with sameness. That clearly means how rigid they are in the way they think, again, the way how they say the same things over and over again, and they like the same thing to be told to them. And if the instruction is changed, they find it very hard to cope with it. I know of a child who would tell his grandmother, "You have to tell this to me when you come home every day." They not only do they try to stick to the same ways of thinking, talking, and behaving, but also expect others to do the same. And the most intriguing part is that sometimes they think that others understand very well what is going on in their head, as if they have conveyed it through some extrasensory perception, and that can also cause a lot of difficulties in relationships. So that's persistence or insistence on sameness and inflexible adherence routines. So as a result, if there's a sudden change, if the teacher has changed, if they've got to move from one class to the other, if they've got to move from one school to the other, they find it extremely difficult to cope with it. There are certain ways how we can overcome that, which I'll come to later. I've said about highly restricted, fixated interests. Most of them are visual. If you were to look at it from a very dispassionate angle, you can see them playing with the wheels. They just love to watch that wheel going round and round. When they look out of the window, they like, when they are going in a vehicle, they like those movements of the objects outside, and the whizzing, how it whizzes past them, and they love that sense of movement. So that's all related to a visual way of fixating their interest, which is quite abnormal in the intensity in which they follow that and the focus that they have on it. So even if you were to change the pictures repeatedly, they would go back to the same old video, and they play the same video over and over and over again. They read the same book over and over and over again. They go to the same school, same teachers, everything has got to be same. So very difficult to move them from a few interests, a few games, to a variety of interests, unlike other children. And again, if they were to focus on one uh, plan of action, it's very hard for them to be made to change from one to the other. Now, the last one that has been added in DSM-5 is related to sensory processing. I'm a bit peeved when I hear people talk about sensory processing disorder as a diagnosis. It's not a diagnosis, it's just a symptom. So it's like saying fever is a diagnosis. So I think we need to be very careful about using such words, because even I have sensory processing disorders, I don't like taste of certain things. I don't like this texture of certain things in my mouth. I don't like the texture of certain clothes on my body. So, do I have a sensory processing disorder? Yes, I have. It's just a symptom, but it doesn't constitute if unless I do not have other symptoms or domains, I cannot be given a diagnosis of autism. But it has been now made into a diagnosis by certain professionals, which I beg to differ. And I think it's high time we took control over that, particularly parents who should decide that it's just a symptom. We cannot make a diagnosis of it. These children who are hypersensitive to stimuli cannot tolerate certain noises, they cannot tolerate certain visual stimuli, and they cannot tolerate smells, even touch, like I said earlier. But at the same time, they, if they have a hypersensitivity or hyporeactivity, they want many of these stimuli beyond a certain limit. Most of them do have ADHD, is what my guess is and my experience has been, because that's a topic that really interests me. So, moving on. So I'll just repeat. Of the three domains that have been displayed under the subheading of social communication disorders, if a child has only those three, then we, or a young person has only those three domains as ticked, then they only have a social communication disorder. But to make it case of autism, one has to have two of these rigid, repetitive, inflexible behavior pattern, where one has stereotypic body movements, or one has to have a challenge in making changes in their lives, or their interests are so restricted, so fixated that it's quite strange that one cannot be moved from that particular uh, interest to others. And then there's this additional hyper or hyposensitivity to various stimuli. I'm happy to take questions at the end of it, because there are some finer nuances which perhaps might need further explanation. Right? This is something that gets missed very often in many of these neurodiverse conditions. Actually, executive functioning is something that is very seriously affected, because that is something that happens as a part of your neurodevelopment. One has to test out various skills, motivate yourself to first of all initiate that task, and then go through the various steps of the task and finish it. And at the end of it, evaluate, is this the right way? Will I use it again? And if it is not worth trying that path again, find another way to go around it. Many of these skills are affected in all most of the neurodevelopmental conditions. That includes ADHD, autism, as well as developmental coordination disorder or Tourette spectrum disorder. All of them do have a difficulty in pursuing a task with a motivation from the beginning to the end. And if they find that there is an obstruction in the way, rather than giving it up, going across it, finding some ways to go around it, and if there are distractions, learning to suppress it and move forwards towards the final outcome. That is something that's affected in most of these conditions. um, yeah. So, as a result of this, suppose if one has a constant sense of hostility wherever they go, starts right from home. You wake up in the morning and your mom says, "Come on, it's time to go to school. Come on, get up. You got half an hour only. You got to get dressed. You got to do this, this, this." There's a sense of rising anxiety in them already. Already the night before, they have been struggling with the thought, if they go to school, that teacher is going to find them guilty for something, or that girl sitting next to me is going to touch me and I don't like that, or there's that smell from the front seat, boys different box, I don't like that, and there's so many people in the class. There's already a sense of hostility that's running at a low level in them even before they have started the day. And when they go to school, they sense that the route that mom has taken is not the normal one. And they find if there are lots of people on the road and there's been some accident or something, and it takes a longer time to them to get to school, they are stickler of times. And if the time and the place where the car has to be parked, if it's not the same, they get all anxious. And anxiety is displayed in many ways as fear, resentment, anger, and many other expressions. But the final tip of the iceberg is basically anxiety. Anxiety is actually dealing with many of the scenarios that one has in your mind. Most of them are imagined. And if they were to happen, what would I do? If this happens, what would I do? Well, if this happens, what would I do? If C happens, what do I do? If B happens, and if you're a bit more on the higher spectrum of cognition, you have thousands of scenarios to play with. And each scenario goes on and on and on in a frenzied manner. So by the time you come to the school, you are an emotional wreck. So that's one main reason for many of them to be seen to be on the edge all the time, because they are expecting trouble. That's because of what they have experienced in the past. Small, small, small failures, small, small, small uh, cross questionings, reprimands, restrictions put on them. So they store all that. This is called negative bias. It's a well known psychological phenomenon where any negative experience that we have undergone in our childhood is stored in the libraries, in the vaults of our memory, to prevent them from happening again. And every moment you are expecting all those things to happen and you're planning for them not to happen. So, what happens in the long term, in the bargain, is that you forget to live in the moment. You're either connected to your past or you're planning for the future. So sadly, they miss out a lot on what's happening. So miss the woods from trees, as they say. As a result, because of this constant sense of friction with the environment, they learn to slowly disengage from this environment. So complex learning difficulty sets in, because one has to have interaction with the environment to learn not just English, mathematics, science, but also behavior. Because someone should be giving them feedback, they should be receiving the right signals from the environment that tells them perhaps this behavior is not acceptable, and I have got to change the way how I approach this issue. But rather than they carry on doing it, and that's again a measure of lack of empathy or sympathy. How sad is that? So, moving on, a time comes when they feel that this world is not listening to me, neither am I going to listen to it. So, there is a tendency to become sort of deaf to what instructions and messages are given, and they often turn into a creature where any little trigger causes them to have huge emotional tantrums. And these emotional outbursts are not a short one. They can carry on for hours, maybe for days. Because what is happening in the system is that they are going through a phase of flight and fight, of fight and flight responses. I wonder if you know them. I wonder if you are aware of these things. These are the primitive survival instincts that we have been endowed with, which has run through several centuries and has been provided to us to save us from any saber-toothed tiger or elephants or anything from the Jurassic age. But currently, they are replaced by human beings like us. So their life is clearly under scrutiny, and they feel all the time being judged and being reprimanded because of the differences that they have. So someone who knows I'm different, someone who knows that I'm not able to perform in the same manner as my mates, always has a feeling that I'm not good enough. And they are in a state of sympathetic upregulation, which just means, those words sound fancy, it just means that your sympathetic system is acting overtime. You're producing a lot of adrenaline, a lot of noradrenaline and steroids in your system. And these are the hormones that get you ready to run or to fight. And even avoidance is also a run. So if I know that tomorrow I have a session where I'm coming face to face with a teacher who's a real nuisance, he makes unwanted comments, he makes you feel marginalized or makes you sit apart from others, you already are in a state of fight and flight. So you're producing a lot of adrenaline and noradrenaline. What do these hormones do? They make your pupils dilated so that you can see more. Your nostrils widen so that you can draw in more oxygen. Your heart beats faster so that you can pump more blood into your system. Your muscles tense so that you can get ready to either fight or flight. And nearly all, and it releases a lot of chemicals elsewhere as well, like cortisol, which releases glucose from your system so that your muscles can function at its optimal rate. So someone who's going through this fight and flight response all through the day finds their Even the brain cannot calm down after some time when it's time to sleep. So very often, many of these temper tantrum prone children have a difficulty in falling asleep because they are ruminating on what has happened through the day, and they're anticipating it to happen next day. Like I said, this results in a huge explosive release of adrenaline or adrenaline, which takes a long time to die out. And as a result, they are left in a state of sympathetically upregulated. And one has to train them to access the parasympathetic uh, nervous tract to bring down these constant sources of anger or emotional outbursts. And they need a long time for be reassured. So one can just let's have a quick look at negative feedback. When someone is, any one of you, is told that you're not good enough, when you know you're not good enough for that particular skill, and you're constantly told that this is not right, that's not right, this is not right, you start to feel that maybe what the other person says is true. You start to identify it with your personality or with your identity. Then it slowly starts to erode your self-esteem. Self-esteem is the true identity that we hold, the golden creature, being that lives within us, that you want to present to the world as the best, as the most lovable, as the most most rewardable. Such a person does not exist anymore because you're constantly getting feedback from the environment that tells you you're no more. So after some time, you become deaf to these negative comments that come your way for the simple reason that it makes me feel turbulent, so I'm not going to listen to it. That is a very common phenomenon seen in most of these conditions. Now, main characteristics from what I've described, all the domains, is that there is a difficulty in communication, in transmission of information when it comes to emotions. You don't, you're not able to transmit it, neither are you able to receive it. And when the other person transmits signals of emotions, you're not able to receive it in the appropriate manner. And that can have an impact on your interpersonal relationships because one needs to understand others' emotions and maybe put their needs before yours. And that's how human beings, coexist in cordial relationships. Now, going on to behaviors, all the stuff that I've described to you about being rigid in the way how you think, on the way how you talk, on the way how you act out, clearly has an impact on the environment around you, which wants you to behave in the box system that the conveyor belts produces in schools and in homes. So you're different. So you're treated differently, and what comes out is a sort of aggressive or maybe a resistant or a passive transgression kind of behavior out of these children. Um, As one can see, the secondary difficulties that emerges are the loss of self-esteem, the identity that one holds very close to one's heart is crumbling day by day, and you have a difficulty with peers because you know they are performing at a better level, and they also jeer you, they marginalize you, they bully you, and as a result, your self-esteem further gets lower and lower, it spirals down. And the relationship you have with adults, because you don't understand them, you don't see them as holding a sense of hierarchy, and you treat them often at the same level. You go and mess with little kids playing in the mud, and you don't understand that's perhaps not appropriate for your age. So you do end up in a very socially awkward uh, situations, and are often called as inept or socially awkward person as well. So those are the secondary difficulties that emerge out of this. Now, I'm quickly going through management. There are many factors that might have been missed, but I'm trying to pack in so many things so that it makes uh, quite a lot of things that I've said before. It makes sense to you. So we know that some children are different from others. So what are the differences? I mean, I put a few of them there. They are rigid in the way they think. We are told. In Malayalam, it's called vashi. It's very stubborn. But I would say, I wouldn't call it stubborn. I would call that they have they need a clear structure, and they love that structure, and they love to follow the structure, and that structure becomes their mainstay of their existence, which not many people can follow. And they focus on finer details, whereas others focus on the whole picture and make several little intricate mistakes. These people are there to pick on those little mistakes that might be experienced as being critical of the other people who work around them. But if we were to praise them for those catching those finer details, actually what comes out is a sort of a symbiotic relationship where the people who miss the woods for trees because of their inattention or variability like me do benefit from support from people who look at the finer details. And we know to find these finer details, one has got to use your eyes. They are masters in assessing and accessing information from the environment using their eyes. I do not know if you have heard about an artist called Wiltshire, Wiltshire. We used to go home and look at his portfolio. He looks at a landscape for about a few minutes, few hours, and then turns around, never looks back, and draws the whole picture with every single building intact. He might look at, I had a patient where the child would look at the window and she would start to draw before she goes. I hadn't even seen the crack in uh, the window sill, and neither did I see a cobweb at the bottom, but she had picked all that. And that was a positive. I gave her a lot of positive input into that. But what I noticed that mom was saying she does these useless things as she was describing it. So many of these acts, these stereotypic movements, many of these rigid, inflexible ways of thinking and behaving are seen as purposeless. But they do serve some purpose for these children. But we should make it useful for them so that, in the sense, we use those unusual tools in their life timetable so that they make use of it in a more effective manner for their own benefit, which I'll come to later on. I always say your child is your child. It's not your neighbor's child. It's definitely not your neighbor's child. And if he should not have in any way rules set by you because of others' input and others' intervention or interference, as I call it. So, grandparents are known to be quite, I would say, ingenious in the way how they try to control you when they had no control of you when you were a child. And very often they ended up giving you advice when they had no right to give you advice because they treated you really badly as a child. And you should remember the generations have tremendously changed. What used to be done 20 years ago is not the norm today. In my younger days, well, that's several years ago, a mobile did not exist. I used to carry a brick for the first time when the mobile came. I used to say it's for my self defense. And now look at how sleek it's become. And children are very good at accessing information. And they know the difference between information and knowledge because they are very quick to get rid of unwanted stuff from it. And they are becoming wiser earlier than us. But at the same time, at a specific cost, they forget to note some of the finer details, unlike children with autism. So, if we know what your child is, what his strengths are, we need to put all our effort on and finding their skills, virtues, talents, and progressing it further, and giving them positive feedback to that, so that they feel that I am valued in my home, that I'm respected in, and I respect in my home, and I can carry on with dignity in my home. We cannot change the world, but at least at home they should feel that they can let down their hair and be themselves, because all day they've been holding their uh, tension and stress altogether. And when they come home, they would want to let go of it. But if we put these strict, rigid strategies at home, very often you will end up having a child who is completely alienated from home as well as from school. And these are the kids who can go wayward and perhaps access unwanted behavior. And it's very well known in children with autism to access drugs, to access all kind of unusual sexual activities very early in their life, and often they do end up having serious problems, emotional as well as psychiatric problems in the long run, due to the constant struggle that they have with changes and with the changes expected from the environment out of them. Now, if you know your child well, you know these are the difficulties. There are several ways to circumvent them. Technology is advancing at such a fast rate that nearly any issue can be dealt with by technology. If one has a problem in expressing one's emotions, all you need to do is get a laptop and download an app which gives the child an opportunity to express their feelings, their needs, and their emotions. Once that's done, a lot of stress within the family is kind of reduced. There are also certain scales that I use. I think I put them here. So there's something called ABC of behavior. How much time do you have? Okay. We know that antecedent, like an incident, before that, there have been certain uh, experiences that the child has gone through. I'm going through this so that we talk a little bit of behavior next. So, certain things have happened in the child, certain things have been experienced by the child in the past. And he knows that this works, this doesn't work. And the environment also provides certain feedback. If you do this, you're not going to get that. If you do this, you get this. And also, there's a constant sense of hostility that kids with autism are experiencing. So, as an outcome of that comes B, the behavior. That might be a tantrum, or it might be sort of running away from home, or running away from school, or ducking under this desk in school, which leads to certain consequences from the environment, whereas the child's consequence decide might be completely different. So I have seen a child who constantly either passes urine in the class or ducks under the chair, so that the class teacher takes him to the head teacher's room and makes him sit there for that hour. And the consequence that the child wanted was exactly the same that the teachers were giving. He did not want to sit in the class because there was so much noise, there was so much of touching and smelling and everything, which he did not want to struggle with for more than a few minutes. So, this was his way of getting out of the class. Later on, the same teachers started to expel him for a few hours from the class and would ask parents to bring him 1 hour later. And that became his mode of escape from the classroom. So that's a flight response, but he has used it so effectively by manipulating the environment. That's one thing I want to focus on. Children with autism are very clever in manipulating the environment. They control their environment. I say the mothers are almost always the slaves because they were there right from the early days. And breastfeeding or bottle feeding, they feel is a way of nurturing your child and maybe the only way of nurturing the child. And they get stuck with that. And as a result, when they realize this baby is displaying difficult behaviors or behaviors that they perceive as difficult, what they do is they kind of mollycoddle it, hold it very close. And the child also starts to use the mother as an extension of them to the extent that nearly anything that he wants to carry out is carried out by his mother. This is something that I have seen very frequently, and I've addressed this right in front of the parents and told them it is time you learn to detach. It's not very easy to detach from your own child, particularly when you're emotionally entangled with him. But there is a limit to being someone's slave and often losing out on your own life and feeling resentful of the same child a few years later. So it's better to learn to have a sort of a detachment and share the child being cared by the father or other carers, so that one has some free time or some me time, so that it helps them to neutralize some of the negative feelings that comes out of this kind of a toxic relationship, I might call it, the sense when it becomes like a slave master relationship. I say this because it is so commonly observed, and even when I have addressed this with the parents, very often they fail to detach themselves and end up having immense difficulties later on in their life when the child turns into a teenager, when she seeks independence and mother does not let go. This is just a forerunner for several of you who perhaps have children who have not gone to that level. So I said eyes are the portal of entry of any message, instruction, feedback. I'm just giving you a few examples of how one can use eyes to create a structure to the child's day, because they love that structure and they follow the structure rigidly. So often, if you were to sit down in collaboration with the child, create a timetable where one has got to do these things before breakfast, before lunch, before tea, before sleep, it makes it a pattern that children ingrain quickly into the system, and they know that even if the morning has gone a bit awry, they can always go back to the system after that at lunchtime. These are also the foundations of future electronic diary entering, because times are moving so rapidly, and one will have to put in your daily activities on a timetable so that one can quickly access that and make changes to your day as and when required. But the changes that have got to be have to happen, for example, a school reopening, you're going to a new school. My suggestion would be use visual prompts like having a video of the path to the new school as such, the classroom, and the teacher who is going to receive the child, and play it in the background, telling the child that this is the path to school. Or, for example, someone who has never traveled in an airplane to a distant spot for a holiday, and if they are really anxious about traveling in the plane, one needs to show that as a film repeatedly, and within a few days of seeing it, they'll just sail through the security gate and get into the flight and get to the destination without any difficulty, as he would do if he were taken to a new school where he knows the path and he knows the teachers. I think that is something that can be used very effectively, even in a task as simple as brushing the teeth. There are some children who are very resistant to that. But if you were to look into if you look into YouTube, there are plenty of videos produced by parents who have children with autism, and they are all out there for anyone to use. It's so simple these days because of the visual media that's available. And since children with autism are more visually alert, visually they absorb more information, one needs to use that so-called negative behavior, because they are so, they have stick to finer details. They are very finicky. That's the way how they're described, but actually that can be used as a strength. That's one trick I would say. It's a visual attention. Rather than having any auditory processing defect, actually it's the visual attentiveness that takes over. Now, when we see a child with HD behaving nicely, we need to catch them doing good, because every child thrives in praise, and give them lots of positive words, but along with that, a visual prompt saying "good girl," or write it down on write down on a whiteboard saying that this is a star for doing this, because a star loses its charm, it loses its value, it even loses the sense of what it was written down there for. So if the stars are being used, you have to use them effectively by noting them what they were for, and having a book where one constantly gives positive affirmation to the child, sitting down with the child and writing a golden journal where what happened during that day that was positive, only that needs to be recorded. That gives them a good sense of positivity that surrounds their life. Very often they are living in a bubble where they feel my whole life is negative, there's nothing that's worth living, and everything that's happening around me is hostility. That changes. And it's known that within 6 weeks of trialing this golden journaling, their whole way of approach to the world, the negativity dissolves, and they see more positive things and reach out for positive things in front of them, and they constantly try to access that. There's also something called ingraining positive emotions, where one is asked to hold to positive feelings for a longer time. You have a cup of hot chocolate and you like it, don't glug it down. Sip it and slowly enjoy, savor it for a longer time. And that makes your brain more perceptive to positive things happening in your life, rather than constantly dwelling in the deep, dark dungeons of despair of the past, because that's what we are prone to do. And in children with autism, because we got so many experiences that they felt as negative, that library is huge. So one has to teach them to, rather than carry those heavy bricks in their haversack of life, take them out, throw them, put positive things. And that's the way how they need to move. I can only advise these things, but parents have got to learn to devise ways to go around some of the difficulties that might come even while trialing out these tricks. Now, if someone does something negative, and if he, particularly someone who is in a state of high emotional uh, drive, there's no point in trying to reason out with them because adrenaline and noradrenaline are at its top, and steroids are also running more than it ought to. So as a result, such a child is very defensive to any information, any feedback. Number one, they are not even aware of what's happening around. They're blind and they are deaf. That's why later on, when they come out of this spell of anger, you ask them who were there around you. They don't know, or what led to this behavior. They can't remember because there is a sense of complete blinding at the time, and what they do is completely beyond their control. That's because the high level of steroids in the system. And as your steroids gets pumped up each time you have these emotional outbursts, the threshold for these or the trigger becomes lower and lower and lower. So that's one thing one needs to know in advance. There is a chart by Buron and Curtis. It's worth going through that. Buron and Curtis, two school teachers who created this anxiety chart, and which can be color coded and handed over to children so that they can point out, because they don't have words, they don't sense the rise in them of the emotional, bubbling up emotional charging up. So they can score it. They're always at a green or yellow level. Then when it goes to orange, when it goes to, by the time it gets to black, it's a point of no return. But if you catch them at amber, you can always reverse it, is what they say. And it has worked out in many of my kids in UK. I'm yet to have some parent who's happy to trial it out. But if that is used on a regular manner in your home and also in school, like seamlessly it goes across to school and at home, you draw that chart, laminate it, and the child takes it around, and parents or the teachers ask her where you are, so they know in advance that the child is going up or going down. I even tried to devise a wearable where the trends are recorded, so that when your heart rate starts to go up, or your breathing goes faster, or your temperature starts to rise because of the rising sympathetic upregulation, it gives the child a warning so that he can be self-aware and self-regulate, remove him from the environment, and come back when one is more level-headed. I hope it'll turn out someday. That's just to show how visually attentive they are. Instruction board, again, these whiteboards can be used very effectively where you can write down what they got to do during the day. Because telling them, honey, on the way back school, would you mind bringing honey, butter, egg, bread? They'll come home empty handed, but if you could send them a text, they'll definitely bring it. So use ice most effectively. Cards can be used as cues. If you want them to stop in 5 minutes, it's no point shouting 5 minutes, 3 minutes, 1 minute. It just does not work because as your volume goes up, someone who is very noise uh, defensive, as the noise goes up, the child becomes more and more defensive and more resistant and lesser reactive to the uh, increase in your volume. So easy ways reduce the volume by putting 5 minutes card, the green one, 3 minutes card, amber, and 1 minute card, red color. So the child knows initially for every single strategy that you put into place, there is going to be resistance because it's a change. But if we play it subtly or play it in the background, even if it's not for the same kid, play it with another child, they learn to access it quicker. But when it is addressed directly at them, very often we find that children do not want to access that. So the cards can be used for asking the child where your anxiety is, how anxious you are, or it can be used to curtail the time that they are playing on screens, or they can be also used to give them a distant feedback, like some parents do. They use the green card most often to the children, and when they find that they're slowly crossing the boundary, the yellow card comes out, and when it's red, Emotionlessly, the child is picked and removed from the environment and placed in a non stimulating environment for a couple of minutes. Explain it to them why, without shouting, without raising your voice, in a very like a report is read out with no feelings. At the end of it, if the child comes out feeling reprimanded or feeling treated badly, you need to give them a cuddle and tell them we'll talk about it later. And when one is in a more conducive mood, explain to them with a good positive beginning, and then describe to them what the behavioral pattern was, and tell them, give them your recommendation in the sense, please do not repeat. This is the um, emotional barometer, as it's called. It can be used, it can be actually downloaded from internet. If you were to uh, print emotional barometer and look at the images in Google, I'm sure you'll get them and print out, and you can use them effectively. See, in this, some parents use these B&Q tents. I don't know if you have them within the house where there's nothing inside the tent at all. And it's kept in a place far away from the rest of the house. So there's no TV, nothing playing. The child is taken there and placed there. And it's surprising that many of the kids with autism, even before you have picked them up, they know they've done something wrong. If there's remorse, they walk all the way to the tent and go and sit there till they feel calm. So we're actually teaching them self awareness and self regulation. Now, so this is what I said about earlier. Remove them from environment for them to learn to self-soothe and return when they come. Lots of positive feedback should be given. It can be either as a post-it note by writing something positive about the child, or as a star, or anything, a smiley face or anything, and lots of cards, love cards to the child. And well, there were lots of studies around marbles or giving them positive things. None marbles do not seem to work because we do not know what each marble was for. So you've got a bottle full of marbles. You can't really delineate which marble is for what. Is this for studying? Is this for keeping your shoes and socks at the right place? Is it for getting ready to school at the right time? None of those things are descriptive enough. So a marble as such does not represent anything specific. So one has got to make it more specific, is what I need to point out here. So, in summary, we have to tell the child, I love you, but not the behavior pattern. It shouldn't be that I hate you and the behavior. If they realize that behavior is something that's not them, and if they realize that parents are loving them come what may, but it's only the behavior that's unacceptable. They learn to cope, change many of the behaviors. I don't mean change for the sake of changing for the people around them, but for their own benefit. And behavior is something that's the most simple to reverse at that stage of their life. But as they grow older and as they come closer to teenage, it's going to be extremely difficult to reverse many of the things that we have set in. I think that's where I'll stop. And if there are any questions, we'll talk about later. So let me just quickly recapitulate what I've said. There's a paradigm shift that has happened currently. And the most important thing that we need to know about that is we do not see this as a disease or a disorder. We see this more as a neurodiverse condition or a difference in a human condition, and we need to accept them as they are, not try to change them, but at the same time use the difficulties that they are noted for and use them effectively to bring them into the mainstream uh, path, rather than marginalizing them, making them feel shameful, making them feel guilty, particularly if they have autism, because they find it very hard to change their behavior. So the best thing to do is understand your child, find his strengths and skills, and work on them. And if there are any difficulties that you encounter, try to find ways around them. Gadgets, electronic gadgets are innumerable. They're coming day by day. And if you just Google autism related gadgets, you'll get hundreds of them. Use them effectively. Don't simply throw your money because it doesn't help. In all children, everything doesn't help. And the most important thing is love your child as he is, as she is. Because, like, I sent this story written by Mitchell. He's a well known American scriptwriter. He had written about his child's autism and the various difficulty they go through, first of all, with the weird diagnosis of autism, not knowing what it is, and later on understanding that uh, there are many newer words that you learn while you are there, like intervention, early intervention. To be honest, I don't like that word. I don't think intervention is almost equal to interference. It should be something more normal that they do to change some of the patterns of behavior that other people find daunting. And I think the most important thing is enjoy your child, enjoy your child's growth, whatever the diagnosis be. That's why I'll end there. And I hope if you have got any questions or if you need clarifications, send them on to us, and I'll be speaking to you at the end along with Preeti. Thank you. Thank you.
Thank you, Doctor. It was a great talking, actually. We had an eye opening idea about what is this about and how this should be handled in society. And it is very clarified that we understood a lot of things. And we'll be taking some questions up on the chat box. Whoever is having some questions around, so you can share up your opinions or any kind of questions you can ask. So next we have Preeti Dikshit, who will be coming up with her own ideas and viewpoints about. I should introduce her to be like a great personality. I can tell you. The reason is like she is the co-founder of Care for Autism, where they are doing massive kind of information to the people who is having autism, who is a parent of autism, both. So she was having a child. She'll be giving an idea about what she is of and what she was of, and it will be a great, interesting kind of suggestions or else eye-opening to many parents who is having an autistic child, because she'll be telling about her son who is having an autism, then how she have recovered the situation and how she came up with the a kind of the organization called Care for Autism. So she'll be connecting soon, so we'll have a short interval on here, then we'll be back in live in 30 seconds. Mom, you can start. No, you'll be audible.
Okay, okay. Hi everyone. Dr. Setu has given so much of invaluable information about autism that I'm kind of speechless right now. I had thought that I would talk about my parenting journey and the lessons that I have learned along the way. But I think I will start with the current situation where me and my son are right now, and then I will go back. So, my name is Preeti. I'm the mother of a young adult with autism. My son is now 20 years old, and he was diagnosed with autism when he was 4 years old. Um, our autism journey began 15 years back, and finally last year I myself was diagnosed with autism. So a lot of my thoughts and a lot of my perspectives have changed since I was diagnosed with autism and since I connected with other adults with autism, and came to know how lives of autistic people are in India and abroad. So, when my son was diagnosed with autism around 15 years back, I had no idea what autism was. And he seemed like a very normal child to me. This is something which I find very curious now that I am diagnosed with autism. Is that when my son was born, he was a normal delivery. He was a normal baby. Uh, there was there was nothing wrong with him, and I raised him as I would raise a normal child. I loved to play with him. I loved to interact with him. We had a really good bond. The only things that I observed when he was a baby, the first thing that I observed was that he had a lot of difficulty sleeping. And the second thing that I observed was that he had difficulty eating, and he had developmental delays. So those were the red flags that we had. But the doctor never pointed out that there was something wrong. It was only when he started school, and he found it very, very difficult to adjust to the environment in school, that the teacher called us to school one day and told us that she thought that we should meet with a child psychologist because my son was having a really hard time in school. And I was really surprised by this because I hadn't ever felt that there was anything wrong with him in terms of the way he interacted with others, or in terms of the way he behaved. So when the teacher called us and told us that he was having severe behavioral issues in school, he was hitting other children, he was crying, he was screaming, he refused to sit in one place, and he was just all over the place. So I was really, really surprised because this was a side of him that I had never experienced before. So then we met a child psychologist who conducted an assessment and diagnosed him with autism and ADHD. We took a second opinion with a child psychiatrist who confirmed the diagnosis of autism, and told us that we needed to start therapies to help him. We were directed to a center where they had behavioral therapy, speech therapy, and occupational therapy. My son was what they call non compliant, and so they told us that we needed to do behavioral therapy first for him, because he refused to sit for the occupational therapy and the uh, speech therapy sessions. We had no idea what we were supposed to do, so we were just blindly following whatever the doctors told us. The behavioral therapy sessions were kind of like a reward based system, I would say, where the therapist would ask him to do certain things, and if he did them, then he would be rewarded for it. And if he did not do them, then he would not get a reward. And somehow this just worked for him. It got him to do things which he was refusing to do before, but it came with a lot of distress on his part. Um, Again, something which I had never experienced with him at home and was very new to me. I really couldn't understand why he was having such a difficult time listening to other people and following instructions. And I wondered whether it was because I had been too lenient at home, or maybe I had been too overprotective and permissive, and I had spoiled him. It's only now, now that I am diagnosed with autism, that I understand it in a different light. But at that point of time, I felt like I had failed as a mother. I uh, So I decided that whatever the therapist told me, I would do. After a few sessions of behavioral therapy, we started occupational therapy and speech therapy. And the therapist told us that if we continued this for a year, he would get better. When they said that, we thought, okay, we had no idea what having autism meant. We had no idea what the future held. And so our immediate reaction, as is I think of most parents who get this diagnosis, was to find out how my son could overcome the diagnosis. It was all about getting making him better, getting over autism, the first thought that came to our mind was, is there a treatment for this, is there a cure for this? The doctor clearly told us that there is no cure for autism, but therapies can help them to a great extent. So we literally stopped everything else. My husband took a break from work. I we took my son out of school, and we just focused on therapies. And we thought, okay, we'll see a difference in him soon. And so it was like a month of therapies, 2 months of therapy, 3 months of therapy, 4 months, 5 months, almost a year of therapy, and we could hardly make out any difference. And that was the first time when we started wondering whether this was really helping our son or not. uh, the the whole concept of intensive early intervention, which was very aggressively pushed at us in the beginning, almost promising that our son would recover from autism, didn't really seem to be holding up. So we realized that this was not working. We could not put our life on hold just to do therapies. We had to address it holistically. So my husband went back to work. We started restarted my son's schooling, and we went back to how our life was before the autism diagnosis, and side by side continued the therapies. This is the biggest lesson that I learned during those first few years, was not to put my life on hold, not to focus completely on therapies as if our life depended on it, but to do therapies consistently on the side while doing everything else. um, that definitely helped my son. Occupational therapy, sensory integration therapy was very, very useful for my son. He was nonverbal until the age of 3, and he was need-based verbal until the age of 5, and he started speaking fully when he was 5 years old. But he had a lot of motor coordination issues. He had a lot of sensory issues, and these were addressed by occupational therapy, which we continued until he was 12 years old almost. So occupational therapy activities, sensory integration therapy activities were almost like a part of our routine. It wasn't like we did it for a few years and then we stopped. No, it was almost like, how you have breakfast, lunch, and dinner. We had occupational therapy and sensory integration therapy activities scattered throughout the day, depending on his needs. So sometimes he was very excited, or very charged up, then we needed to do some calming activities. Sometimes he was feeling low and he was not very motivated to do anything, then we needed to do some alerting activities. This is how we did the therapies. On the schooling front, my son was going to inclusive school. When he was diagnosed, he was in junior KG. And when we took admission for first standard, we told the school that he was autistic, and we took admission based on that, that he needed some support because he was autistic. And the school was quite supportive in the beginning. However, as the classes increased, as he went from first grade to second grade to third grade to fourth grade. And as the academic pressure increased and as the social pressure increased, as the demands of following the rules and meeting those expectations became more and more, my son started finding it very difficult to manage in school. And finally we were told that we were called by the teacher and told that we should look for other options for him because he was having a very hard time in school. What they meant by that was that he was literally having a hard time sitting in one place in school. He was he had started having meltdowns because he was overwhelmed. And he was just really struggling. um, so then we looked for special schools, but in my son's case what happened was he had a pretty good IQ. And the special schools told us that he was not the right special school was not the right fit for him. So I was really not sure what to do, because here the inclusive school was telling us that they could not support his needs anymore, and the special schools were telling us that they could not support his abilities. So I was like, what am I supposed to do now? That is when we started homeschooling. So I have been homeschooling my son for the last 10 years, and that has worked out really well for us. Right now, at the age of 20, he's fully independent. He has overcome a lot of his challenges. He loves writing. He writes blogs about cars. That is his special interest. And he looks forward to become a car blogger. So this is our journey in short. Now, a few things that I would like to stress on the lessons that I learned during my parenting journey. The first and foremost lesson that I learned was that I, at one point of time, when my son was diagnosed with autism, and we were told to focus on therapies because that would make him better, I forgot that I was my son's mother first. I was so focused on working with him. It was all about, okay, I need to do this with him, I need to do that with him, because I felt like time was of the essence. I felt like I had to cram everything in those first few years to make it work, to help my son. And so I after maybe 2 or 3 years of doing that, like I was possessed literally. I realized that this was not working. I had lost my connection with my son. The bond that we shared before his autism diagnosis was almost non-existent. My happy, smiling, bubbling, lively boy was a mess because I was treating him like a project that I had to work on instead of a person with needs, with emotional needs and feelings. And so, one of the biggest lessons that I learned from my parenting experience was that I needed to be his mother first. Um, I could not be his therapist and his teacher and his counselor and his psychologist and whatever else that I had took up on myself. I was going to be his mother first. And the moment I decided that, and I decided that we would go back to how our relationship was before, my son immediately calmed down. All the meltdowns decreased. Uh, he was he was in a much more receptive position to listen to what I had to say, to learn new things. uh, the second thing that I have learned in my parenting journey is to live holistically, not make your life completely about autism. Because in the beginning you feel, and everybody tells you that time is of the essence and you need to do everything now, you need to do as much as you can so that your child has a better future. But that is not really true in my experience. You have to keep working with your child, not like a crazed person, but in a balanced manner, because a child doesn't stop learning. A human being doesn't stop learning. I'm learning even now. So, this whole idea of there not being enough time is really, really wrong, and it sets you up for failure. It makes you feel that you need to stop doing everything else in your life and just focus on this, and that is not true. So the moment, the first thing that I decided was to be a mother and to love my child, to enjoy with my child, to bond with him, to just enjoy his childhood like I was before, and things were okay. And the second thing was to live holistically, to not just focus on autism all the time. And this helped not only my son, but it helped me, it helped my husband, it helped our marriage. Otherwise, there was so much of stress on us as parents, on us as a couple, because suddenly there was a lot of pointing fingers. There was, you didn't do this right, that is why he's like this. Nobody understood what autism was. It became a whole blame game, and it was a really difficult time. So that is the second thing I would say that I have learned in my parenting journey. The third thing that I have learned, and a lot of parents I know face this, is about schooling, where we are told that as much as possible we should send our children to mainstream school or inclusive school. But I would like to say that, if it is possible, yes, if it is possible for your child, if your child is able to manage in a mainstream school or in an inclusive school, then that's great. But if your child is not able to manage, there is absolutely no harm in looking at special schools, exploring other options like homeschooling. There are so many ways for a child to learn other than sending the child to school. So you don't have to panic. You don't have to think that it's the end of the road if the mainstream school refuses to give your child admission, if an inclusive school refuses to support your child, because all of us know that the ground reality is very, very different. Everybody who claims to be inclusive is, more inclusive on paper than anything else, and they really don't have the resources that are required to support an autistic child. So don't stress yourselves out unnecessarily. There are many other ways to do this. That's the biggest thing that I have realized as a parent of an autistic child, is that I need to let go of a lot of conventional norms that I have grown up with, thinking that this is the only way of living life. I have had to question a lot of things as a mother of an autistic child, and I have had to change my thinking about a lot of things, and that has helped a lot. Again, with schooling, be flexible. The third thing that I would say is, or I would like to talk about, is focusing more on overall development. um, it's when you are a neurotypical person living in a neurotypical world with a neurotypical child, you have a very set path in front of you. So once you are around 4 years of age, you start school. Then you spend your next how many years, 10, 12 years in school, and then you go to college. Then you spend 4 years in college. Then you start working. But the path of an autistic child is different, and you have to find smart ways to handle that. uh, you have to think out of the box. So, with my son, for example, even though he went to inclusive school for the first, until he was 8 years old, he was really, really lagging behind in ADLs. He was really, really lagging behind in self help skills. He was lagging behind in so many functional tasks, so many functional skills. And so, one of the first things that I did when I started homeschooling him was not to focus on academics, but to focus on ADLs. Because those are the building blocks. You have to get the basics right first, and then you can work on academics. In my opinion, is secondary to self-help skills, life skills. And what that did was it made my son more confident when he could do all these things, and that helped him build his confidence, that helped him become more he was in a good place emotionally, I would say. And it, building that building that foundation has helped him reach other goals, other milestones, uh, things that will help him become an independent adult. So these, I would say, are the few lessons of parenting. I am really thinking about what else I need to talk about, since Dr. Setu has covered so much already. And I think the only other thing that I will say is that as a person who has been diagnosed with autism myself, it's really time that we start looking at autism as something that is a different neurotype, a different way of thinking, rather than a different way of behaving. There is so much focus on behavior. The diagnostic criteria of autism, when a child is diagnosed with autism, are based on behavior. But what I have realized, and what the autistic community is now saying, is now telling people, is that behavior is just the tip of the iceberg. The difference is in the way we think, the difference is in the way we process information, and behavior is just a manifestation of that. So, like Sinan said, I have been running this initiative called Ask Autistics, where we have gathered about 20 autistic adults, some of them who are parents and children, and they have been giving insights to parents about autism. And this is something that is really required now. I realized this when I got my autism diagnosis, and as my son has grown, um, I started feeling that I had a lot of autistic traits. And so I connected with the autistic community in India and abroad. And I realized that there was really a huge gap in what parents thought autistic children needed, and in what these autistic adults were saying they needed when they were children. So it became my mission to close this gap. I realized that this is nothing, there can be nothing better than an autistic person sharing their experiences of childhood with parents of children with autism. So, like Dr. Setu said, that there is a medical model of autism, and there is a social model which has now come up, which talks about autism as different way of thinking, a different way of being, rather than a disorder or a disease, rather than something that needs to be cured or treated. And the autistic adult community is a great example of how, just because we have these patterns, or we have these uh, thought processes that are not neurotypical, or how they are supposed to be according to the majority of the population, does not mean that we are done for. It does not mean that we are incapable of doing things. We have both strengths and weaknesses, just like everybody else. We have some really quirky behaviors, I know, but we have some really fascinating way of thinking as well. And I would really invite everybody to come into our world, to try and understand us, to try and understand why we are the way we are and why we behave the way we behave. There is a it is a different world, and but it's not an abnormal world. It's not a flawed world. It's just different. And I wish that more and more people would start interacting with autistic adults and start getting insights into this world, start helping us by giving us the support that we needed, by providing us accommodations that we need, rather than trying to change us and get us to fit into this mold that for some reason people have assumed is the right mold. When I look at the diagnostic criteria for autism, I really feel very sad, because uh, they are so ableist. They talk about things like inappropriate behavior, inappropriate way of playing with things, inappropriate laughter. And I'm like, who gets to decide what is appropriate and what is inappropriate? Just because a child is lining up toys instead of playing with them in a particular way does not make it inappropriate. It's just a different way of playing. It is making sense to the child. And this is one of the things I realized, that being autistic, I never had an issue understanding about my son. um, I did not know why I understood my son so well until I was diagnosed with autism. And now I'm like, aha, no wonder he made sense to me. I make sense to him. In our home, my husband is the only non-autistic person, and he had all these issues which I have seen parents have with their children, where they find it very difficult to understand why their child is behaving in a certain way. And I keep telling parents, there is always a reason for a behavior. It's not that the child is mad or crazy, or he's not out of his mind, or he's not lost it. But you have to get to the bottom of the behavior. You have to understand why the child is behaving like this. It's behavior is the tip of the iceberg. It's not the problem. It is caused by something else, and that is what you need to identify. But I also see that when neurotypical parents try to identify a child's behavior, they are still thinking in neurotypical terms, because of course they don't know any other way. That is how their mind works. And so I, as an autistic person, could connect with my son easily, because I understood what those reasons were, since I have myself experienced them. So, something like a sensitivity causing a meltdown was something that I myself have experienced. So, I had no issue understanding that about my son. But somebody else who has not experienced that would not connect the two. They would not understand why something like a tag of a t shirt is causing a meltdown, or why eating a certain kind of food is causing the child to gag. And because of this lack of understanding, a lot of parents end up labeling behavior as being purposefully problematic, as the child not complying, which is, by the way, a word that I absolutely hate, because it seems to be the goal of every parent to get the child to comply once they find out that the child is autistic. It seems to be the goal of every therapist to get the child to comply once an autistic child comes to them. And the autistic community is now standing up and saying that whatever support we need has to be while respecting our autistic identity. Please don't try to make us normal, because we cannot be like you. Our brains are wired differently. Our brains process information differently. Our brains cannot be made normal. And so, any therapy which focuses on turning us into a neurotypical person by controlling our autistic behaviors, by trying to change the way the autistic mind thinks, are actually very traumatic. And therapies, so as parents, now things are changing. 15 years back, when we did therapies for our son, we had no concept of neurodiversity. It was a very, very medical model. It was a disorder, something that needed to be treated, something that needed to be addressed, something that needed to be changed, not something that needed to be supported. Now I talk to parents and I tell them, think about how you can support your child. I talk to therapists and I share this neurodiversity paradigm with them. And I tell them that, see, your focus should not be on changing the child, making the child normal. No trying to stop stimming, no trying to get the child to make eye contact. These are not what the This is not what the child needs. You give the child the tools that the child needs to manage his challenges, without uh, without trying to change the child's autistic identity. And why you do that? Because, see, it is not possible to change the neurotype. It's not possible to change the child's neurology. So all you are doing, if you try to get the child to change the way he behaves and the way he thinks, is you're going to make the child suffer, because the child only knows that, okay, this is something that is not acceptable, and so I need to stop doing this. So he's just going to suppress it. He's not going to be able to change it, so all he can do is suppress it. And it'll make you happy, probably, as a parent, because you're like, okay, finally my child is behaving the way he should behave, or he's supposed to behave. He sits in one place, he does this, he does that, he's making eye contact, he's smiling, he's saying hi, he's saying bye. But I really, really want to stress on this. I have experienced this with my son, and I appreciate it even more as an autistic person. My parents never forced me to be anything other than who I was. Uh, if a behavior was causing me harm or somebody else harm, they would try to change it. But the change was, they never forced me to do it. They explained it to me, they made me understand. And this is something all parents needs reasons for why they have to do something. An autistic mind does not understand rewards and punishments. It does not work like that. So, for your child to be able to do something, you have to explain it to your child. Even if the child is 4 years old, the child needs to understand why he is expected to do something, and it needs to make sense to the child. It cannot be that, oh, you should eat so that you can play later. That doesn't make any sense. What is the connection between eating and playing? The reward has to be a natural consequence of that action or that activity. So if you eat, you will be stronger. If you eat, you will have energy to play later. That makes sense. So these are all insights that you will get when you talk to autistic adults. And I feel this is the best way to help an autistic child, is to get involved in the autistic community. There are lots of groups on Facebook run by autistic adults, where they give inputs to parents, because this is a perspective that has been lacking until now. Until now, neurotypical parents have just been trying to do the best they can with something that they don't understand, and something that they have no experience with, and nobody they know has experience with. So they are flying blind, literally. But you don't have to fly blind anymore, because there is a huge autistic community out there, and everybody is more than happy to help you understand your autistic child. So make the most of it, and just love your child, enjoy your child, have fun. We are funny people. So have fun with us, and look at life the way we look at it, look at the world the way we look at it, because I feel there is so much beauty in the way we look at the world, the way we look at life. And I would really, really like for everyone to see it from our perspective, you know, and just create this world full of neurodiversity, full of different kinds of minds, full of different kinds of people, everybody learning from each other, everybody coexisting, living in peace and harmony and happily. And it would be a much more rich, it would be a much richer world than a world with just certain kinds of minds and certain kinds of people. I think this is where I will stop talking, Sinan, and we can, the questions.
Yeah, yeah. Thank you, ma'am. Thank you so much. Uh, it was a great talking, actually. It was a nice eye-opening, you can tell, because a lot of parents who is very scared, like we got an autistic child, and very scared to
Yeah.
know how to tell in the society, or else how to get replicated, how to say them. This child is affected in autism or something. So it is a very kind of a good thing that you have told to many parents out here, and they could replicate your way of ideology, where you have worked a lot of things and a lot of struggles. And it is very interesting to know that you have been diagnosed in between as an autistic lady. Still, all these years you have been in a normal way. So that is a great example that we can say to the society, that it is not like autism is not a big deal to many kind of societies. It should be decided or something. It should be with us, and it is not an issue that it cannot be cured, actually. So it can be trained as well. So thank you so much for getting us some knowledge about this kind of things. So we'll start with some questions, and we have a question here. So we'll go with the question here first. Okay, I'll just pop up the question. Dr. Sir, sir, I think you're also audible, right? I think your mic is on mute, or you can. Mic is on mute, you can unmute it.
Hi, can you hear me?
Yeah, okay. So I'll just pop up the question here. We got a question from Baby. Uh, Please share why all the professionals of healthcare have different perspective of autism. Doctors from AIMS, big names, hospital functions, medicine practitioners, pediatric, etc. And how to treat ASDY. So that is a question. So I think you have got the question, so we can start with the answering.
You want to go first, Preeti, or me?
No, I think this is for you.
Okay.
Listen to the
But you'll
doctor.
have to give a response to this as well from your experience. Well, I think basically you need to look at it from two different angles. Number one, in medicine, when we studied medicine, there was no emphasis on autism ever. To be honest, my first face-to-face interaction with a child with autism was when I finished my DCH and I was practicing in a little village. That's the first time I saw a child with autism. But for some reason, because I had a genuine interest in children with behavioral issues, I diagnosed it as autism and I sent him across to England. And he finally got diagnosed with autism. But that was a sheer guesswork. And I had no idea about the criteria, and neither did I have any idea about what it entails to have someone to have autism, and also how you might be seen by the world as a person who has autism. And even for that, I realized there was a stigma because this father did not want me to talk about any particular condition because he did not think that the child had any condition, but he preferred that it was more of a behavioral issue that could be mended. See, that's something you touched upon as well. I begin my talk with parents by telling them that we cannot normalize your child. We cannot change the diagnosis. We cannot change the genetic makeup. Only thing what we can change is the environment around the child and make it more conducive for them to live in a more happy, healthier, and productive life. There's no point in putting more barriers into his way by making more and more diagnostic um, I say, hurdles, adding on to the deficits and telling them you have all these deficits, so you better sort yourself out. And the parents are left without any resources to support their children. This is the commonest problem I have seen. In most of the institutes, they have a system where diagnosis is robust. They go through every single process that's available and try to compete with each other by the research and all. To be honest, I would, sorry, pardon my language, half of this bullshit. Because looking at a person's genes is not going to help with the diagnosis. How much of money spent on making a diagnosis of autism? Sorry, I'm going a bit off tangent, but these institutes that you've named here are very much into looking at the cause for autism and how to prevent it, and also if you
Yeah.
have a condition to find out some medication to rectify it. But no one has spoken about the support. Has any of these institutions done any such study on looking at the availability of simple measures, not anything technological or anything. There's a lot of technological support available now, but none of them have looked into that. That's first thing. In the sense, the awareness, even amongst medical folks, is zilch. Number one. And second thing, I think people who should come into this field should have some form of a passion. It shouldn't be just a you know 9 to 5 job. It's a bit more than that. You should always think outside the box, like Preeti was saying. And I enjoy being with autistic people. I don't know. Preeti says I've got autism, maybe, and I enjoy interacting with them. I like to kind of lead them up the garden path, and I mean, I like to toy with their way of thinking, and I do get some very unusual insights from them. So
Yeah.
there needs to be some form of feeling that you want to do something for them rather than just giving a diagnosis and leaving them adrift or astray. You tell them there's that treatment, there's this treatment, there's. I saw an ad today, someone who is providing apparently holistic medicine and is giving Ayurvedic treatment and is providing tantric treatment and all. Think what a load of rubbish, number one. Number two, he's a doctor apparently. How could someone talk about curing a disorder or a condition? It's like telling someone, I'm going to change you from a male to female
Mm.
just because your father wanted a female child. It's something like that. I really feel I should say, anxious and angry when I see such things. I feel anxious because I realize that people are never going to change. They always want things in black and white, and uncertainty is something that they do not like to face. And when they are faced with uncertainty, they come out with some of the most weirdest of solutions to it. And that's what I'm seeing here. That's that's what I think. And sorry, so putting two things together, we have a bunch of uh, institutes, high-level institutes. Their research is based on something that's not really autism specific or near or in any way supporting autism, but are more to deal with their own self-grandiose ideas. Number one, and many of them do not have the passion to follow through a patient's journey. It's mostly directed towards diagnosis, and that's it. I focus my work mostly on what happens after the diagnosis because that's where I find parents struggling. Like I said, that mom whose tears of having had a diagnosis after 13 years, it haunts me even now. And I don't intend to name the professionals, but nearly from north to south of Kerala, I've been involved. It's a clear case of autism, but that autism diagnosis wasn't sufficient. I had to do a lot of counseling to kind of make her understand. Well, apologizing for the whole of the professional, you know, my counterparts. And said it sometimes it does happen. That's the way I had to say it shouldn't happen is what I ought to say. But I said sometimes it happens that we do miss a few things. Maybe what the child presented that day was different from what she's presenting today. And when you realize there's so much of things that can be done. Many of the institutes here in Kerala, we notice that they focus on certain therapy sessions. But does any child improve the features of autism with physiotherapy? Does any child improve with even occupational therapy? I've got my doubts. Because there's no research, there's no uh, any of these processes that we are employing are not grounded on evidence. So they're all someone's bit of imagination, and none of them have been done as prospective studies. The one treatment method that has got some prospective, that's ABA, and that again has not shown a in tremendous improvement in the child's cognitive or speech and language faculties. I'll stop that. Titi, you might want to come.
No, I just was, pondering on why different professionals have different perspectives. My experience has been, like you said, doctor, that a lot of, doctors have said this to me, that autism is like a footnote, in our medical textbooks.
You've lost, I think. Let's wait. I can't hear you either. Dan, you're
Uh,
also mute.
yeah, I think she have lost the connection. I'll just wait for some time and just continue, I guess. Okay. So I think, yeah, she's back. Ma'am, you
Yeah,
I
can
please.
speak.
lost the connection and I'm back now.
Yeah, yeah, sure. Ma'am, you can speak now. Okay.
No, so I was, just pondering the question, and I have experienced that a lot of doctors in the medical fraternity have no idea about autism. It is only the pediatrician, the developmental pediatrician, the child psychologist, and a child psychiatrist. But if you, my son has, had a lot of other health issues, and we have had to deal with a lot of doctors across the board. Um, Many doctors have no connection with autism, and in fact, doctors have refused to believe that my son is autistic. They think, no, this, he's just a spoiled boy, or he's when he was younger, he's having some behavioral problems. So I think it's just that it's not covered in the medical course. And in fact, I was a student of psychology when I graduated, and I had studied about different psychiatric conditions. but autism was not mentioned even there. It was a lot of other ADHD was there. There was schizophrenia. There was OCD, but there was no autism. So maybe it's a new. Is it a new diagnosis? Would we call it a new diagnosis, doctor? Not really. Maybe in India.
You're on mute, actually.
1950 onwards.
1950. That was in the US, though, wasn't it? Or the UK?
UK, Canada. He did studies in London actually.
In London.
Okay, so we'll go to the next question. I think we have some few questions here, so we'll kick up with this. And I think, okay, we'll just pick up one question. I think my child may have autism, but I'm not sure. How can I find it out? So I think this is a question for both of them actually. So I think doctor can go with the word, or else
Yeah,
we can.
doctor should go first.
Right. I feel, see, the problem here lies in what your perspectives are, whoever this person is. Up to summer, you should first of all have a sort of an objective view, because any of these uh, webinars leaves with all of us wondering whether even I have autism or not. So first of all, if you have got an objective view of what you're looking for, that's number one. Number two, what are the outcomes you expect out of the assessment? And also, what the long term plans, short term plans, and what the long term goals are going to be. So that you have a clear idea before you embark into this journey. Because once you embark, because I think I know Abdul Samad. That's the reason I'm saying this. He has an idea about, you have an idea about the condition. But there has got to be a very clear objective. Just have a quick read. Google is the professor of all knowledge. So please go there first, have a quick browse, and then have a little chat with someone whom you trust, with a doctor. And then once we have a very clear idea of what I'm dealing with, because sometimes what I've noticed is lots of people do mistake ADHD and ADHD like they are the same condition. And when I say I think it's ADHD and vice versa. And sometimes equally comical is the situation when the child has both these conditions. Then
Yeah.
you have been speaking about just one condition, you only suspected one. And that's the time when, as a doctor, I find it very difficult to explain what is what, particularly if they've already made a affirmative diagnosis of one of these conditions in their mind. So that's one thing. Have a very clear idea of what you're looking for. And secondly, one needs to have a quick exploration to know which doctors support your child after the diagnosis. Most of the systems have a system, most of the institutions and people have a diagnosis. There's no further follow-up arranged after the diagnosis. And I think that's wrong. Even in the UK, that's the system. I've spoken about it in many of my uh, sessions there, and without any hesitation, I do give them two appointments on that instance at least. Because though the managers ask you to not give appointments post diagnosis, I do give one, and then a few months later, one like a month later, for people to first of all assimilate what they've heard, process it, and think out what they is right or not, or what is wrong, and come back to me again. And the next one will be, in the second session, I give them advice like what I've spoken about. It's just a gist of what I will give them. There's also a written note which I pass on to them so that they can read it later. And then after 6 months, what all have they been able to employ and what they could not do. And if I see that this family is struggling, particularly if they've not had an opportunity to uh, interact with the school, with the social services. But there are quite a few systems running in parallel in the United Kingdom. If they've not been able to, then I take up touches on the behalf and I work for them to get that what the child deserves, gets it. The third thing I want to say is that even if you have to go through a certain process to get a diagnosis of ADHD. In UK, there are two specific tests that have got to be done. One is the Autistic Diagnostic Interview. I'm in the process of making an online version, which PT is aware of, because I think parents who have autism themselves, they find it extremely difficult to go to a clinic and face a school ma'am with a very stiff face asking you questions. And so none of the things that you want to say come right or right manner you can say. So it's better that they do it from home. And then once you've trials, then they come back. Then we do something called ADOS, which is Autistic Diagnostic Observation Screen, where you have a play-based session. There again, I do see that there are some differences of opinion in the way how it is administered, because not all therapists and professionals who are administering that are child friendly, and many of them do it in a way like they're writing a final exam or something, like a determined look at the child, very like closely, scrutinizing, and the child looks up from the toy and you get fright of his life, and that's it. Particularly the autism, they do not perform, and if you do not perform, it's like you failed the test. So you won't get a diagnosis. And then once you've touched all those gadgets or the games, you have to wait for another 6 months before you can try it out, because you've been used to those tests. So that's the way how it is done. So I think you've got to have a very clear picture of what you're looking for. And then once you're there, you'll have to be subject to these tests. So it's better to go to someone whom you think is likely to give a follow up. Otherwise, I think it's a disaster in the making.
Okay,
Really.
I think we would move on to the next question. This is much too tricky, I guess. Hi, my son is autistic, and normal kids are not allowing my son to play. What helps him to know about social behavior? Give some guidance. So I think this is more to.
It's very difficult. Can you hear me?
Uh, yeah, you can start.
Yeah, can you
Yeah,
yeah,
yeah.
can you hear?
Yeah, is it on?
Okay. This is such a intrinsic trait of autism, that the way we communicate, the way we socialize is just different from neurotypicals, and so it's very difficult to teach an autistic child to socialize like a non-autistic child. But what I did with my son, for example, was be with him. This is when he was around 4 years of age. I don't know what is the age of this child. So when my have they mentioned the age?
No, 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 not age.
Okay. So when my son was around 4 years of age and he really wanted to play with the other kids, but he did not know how, what I did was I would be like the mediator. So I would be with him and I would kind of guide him to do, okay, you can now say hi, or you can now come and sit here. And that guided kind of socialization helped him to play with the other kids and the other kids to play with him. The other thing that I did was model some social interactions. Me and my husband used to model some interactions so that my son knew what to expect. But it was for a long time that I had to do guided socialization. So I would say that if the child is really young, he would need guided socialization. Help the child understand how other kids play, but it is not going to come to him naturally. So don't expect that you can just leave your child with the other kids and he's going to be able to learn on his own. Be present, guide him, and he will learn eventually.
I say, I mean, I have found use of YouTube and such. I'm not saying social media, but such media where lots of recorded uh, stuff is available that parents have made available. So please do browse, because there's a lot of things that have been made by parents. Unlike parents who have got ADHD, who have got children with ADHD. They think, but they never put it into practice. But if parents have ASD and they have a child with ASD, it will be there in the web for you to access. So surely the question that you have asked will have a response because I've looked at this question and I found the answer. What mom said was visualize, make the child visualize the setup and create certain scripts in the head, just like you said, modeling. I'm using a different word and use that script for the child to go and interact with the children who perhaps do not want to play with them because they feel that he doesn't understand the rules. That's one thing that was there. And another one was show the rules of the game through the YouTube. And the games that they were talking about, I think was what was it? Not cricket, the other one. Oh, in America they play
Baseball.
no
Baseball?
baseball. Yeah, baseball. So it was baseball what she was talking about, and I thought because compared to cricket, baseball is comparatively rules are lesser. It's more relaxed, and again, football might be more easier to take, and tennis again because tennis the swap of points and all they might not be able to understand immediately. So start with some simple games with friends, children who might be able to sort of, I would say forgive, but accept the child as he is, or some cousin or some relative to begin with, and then gradually expand the world to meet up with other children. That's just a suggestion that's been given there.
The son is 10 years old. He have replayed on it.
10 years old. Okay.
10 years.
I think then that's the best, isn't it? That he can understand quite a lot of rules,
He
and
can, he can.
yeah, he can interact. He can say a script, which is kept ready, and that is what should be modeled at home, parents. If there's a person who objects to you're not going to play with him. It's always nice to that shit sandwich we talk about. Go and tell them how much I love to play with you guys, but I know I don't know the rules, but be helpful if you help me with that. And this, kids are not that very wicked, not that evil like us. They won't hold that against you. And if someone approaches them with a very kind gesture, I'm sure they are more inclusive than us. But later on, teenage, forget it. Mind will start to come to play.
Okay, we will move on to our next question that is very similar to the last question actually. You talked about lack of social reciprocal interaction in autistic children. Do autistic children engage in selective social interactions? Example, interacting with some or ignoring others. So it's somewhat related to the last question. So I think who can go with the question, doctor or else Preeti?
I'm dying to answer this.
Okay.
I thought that.
I think Preeti.
because because I do this even now, I don't interact with everybody. I interact with people that I feel comfortable with. I
I'm
don't
honored
interact
that
with
you
people.
interacted with me. I'm truly honored that
Yes,
you.
yes. I like you, doctor. I just like you.
Thank you.
You are my kind of person, so I'm, happy
Thank
to
you.
interact with you.
And
We
her
laughed a
son's
lot actually. 2 hours of me laughing. I don't.
her son is I hear she messaged her son is 2.5 old
Oh, 2.5.
and
Okay.
2.5.
Can you show
I'll
that
just
question
continue with the
again?
question.
Yeah.
My son,
No,
my
we didn't finish the
2.5,
previous question.
Where,
Let's
what
finish.
happened to the previous?
Mona,
same,
same.
same,
Same.
the
Yeah.
same person have given the continuation question. 2.5 toddler, he's 2.5,
No, no,
engages.
but we were not done with the previous question,
Yeah,
na,
yeah,
Siddhant?
we stopped
I
it.
can
We
answer this
started.
one. Answer
I'll
the
just,
first question. Yeah.
I'll just
The
take up
first
this
question.
one second.
First one.
The first one, man. The one to use.
1 second, 1 second.
Yeah. It was about interacting with some people and not with
Ha,
everyone.
some people and
Yeah. I think
Talked
you
about
can start
yeah.
answering very such. Yeah.
social interaction. Yeah. So, as an autistic person and as the mother of an autistic child as well, I can give my perspective. Um, Children or autistics in general are very receptive to how other people view us. We are very sensitive to whether we are being accepted or not accepted by the person in front of us, and so we interact based on that. We don't interact based on whether we are supposed to interact with a person or not. We don't care about things like that person is high up in the social hierarchy, so we need to interact with that person. So even in a group of children, a autistic child will only interact with somebody that he or she feels comfortable with, not because he is the leader of the group, or because all those social norms that are in groups. So yes, definitely, we do tend to ignore some whom we are not comfortable with. And I think that's good, that kind of helps us protect ourselves, since we don't understand the social game playing and all that goes on. So this instinct
Might
kind
be.
of protects us.
And when they come to my clinic, I make it a point to just ignore the child initially because I'm talking to the parents. I know very well that the kid is looking at me and seeing what interaction is going on between me and the parents. And they realize this chap is not something to be scared of. You can see they come around and gently touch me, hover around. And so that means I give them an opportunity to suss me out rather than attacking them straight away. And
Yeah,
that makes
yeah.
a huge difference. Because hospital is a very scary place, and they know if they go there, they are going to be sort of traumatized. So why add on to the trauma by looking such horrible looking persons carrying them out there? So I give them time to thaw. Right. I think the next question is quite interesting because I have a special interest in communication. I was running a communication clinic in England for 8 years, so maybe I might be able to answer that particularly. Echolalia is a very typical feature of autism. But at the same time, it might not be autism either. But in children, we spoke about stereotypies. We also spoke about, well, basically, there are certain repetitive behaviors. And this is, I remember telling that manasa vacha karmana, certain thoughts that go on and 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 on in mind. That's obsessive compulsive, obsessive thinking. I don't know if you have heard about stalkers who pursue women. The girl in no ways has any affection for that man, but the man keeps on carrying on her thoughts in his mind and wanders around her, touches her in the dark, and when he senses that he cannot get it, nobody's going to get it. It has been discovered that most of the people who have stalked and killed women have autism. So that's the thought that keeps on playing the mind, the stereotypes. Sorry, I'm bringing a very gruesome tale here, but that's the way how the thoughts get stuck, attack jata hai. And that goes on and on. In the sense with people, with certain objects, with certain circumstances as well. They want to go back to that again. That's thought. Now, words are also in a similar manner. Some words, if they like the feel of it in the mouth, it might sound ridiculous, but some kids like the feel of rhinoceros. I don't know what it feels like, but that word feels nice apparently. So they play that word over and over and over again. In the same manner, when someone speaks, you can see them already, they're talking with the lips. They're already, it already resonates with them. So it should be a sentence that they heard before and they are already repeating with the lips. And then what comes out is an echolalia. It is a kind of a stimming behavior. It gives them some sense of calmness within the head, and that's all. We don't know why, but like many other stereotypies, this is one of those stereotypies, a verbal stereotype, and it's also an actioning because you're actioning out something. As is the compulsive behavior in obsessive thoughts. So kids have got a way of thinking which goes on, and they demonstrate it, it becomes a compulsive behavior. And in the same manner, if they have found this behavior pattern of repeating something that someone has said, that gives them a sense of some sort of a calmness from all the noise and hustle and bustle around them. So they play it back as a stereotype, and that gives them some sense of calmness, equilibrium. One doesn't know why. It's believed that swimming releases certain hormones, like dopamine is implicated in ADHD, as is oxytocin in ASD. There might be some release of some other neurochemical that we are yet to discover.
I'm sure there is, because it gives so much of pleasure. I don't know about calm, but it gives a lot of pleasure to repeat a word. For example, you said rhinoceros. It's giving me goosebumps. I want to like say it so many times because it's so pleasurable, and I get this like if I'm eating chocolate, how I would feel if I was eating chocolate, or
It
it's
releases
that
dopamine,
kind of.
probably.
Yeah, so it's like, and I
Hmm.
want that sensation, so I will repeat it. So that is one. The
Very
other.
one word. That's an excellent question.
The
Very good question, actually, because this is
Yeah.
something that what I said about the mystifying bit about autism. There are quite a few mysterious bits about autism that we have yet to unravel. I don't know
And
whether we.
that's why, doctor, I keep saying, we people need to interact more with the autistic community
Yeah,
because we know the reasons. We are right here. Please ask us. It's like that.
you need to find out why you
There's so
feel
much.
that. Why this gives you so much
It's like,
pleasure.
and the thing is, I don't understand why it gives me so much pleasure, but I know why I like to repeat it. That much I can tell, that it gives me a lot of pleasure to say this word again and again.
Hmm.
Um, but
It's a
the
common
the
word.
why part of it has to be researched by the medical community.
Yeah, yeah. Very good.
The other thing I would say for echolalia is that a lot of us, since we have difficulty with communication, we tend to practice what we are going to say. So for example, now if I'm going to come on this webinar, I'll be practicing in my mind what I'm going to say. Kids do this with words, older kids will do this with sentences, adults will do this with paragraphs probably, but we are practicing what we would like to say. It's also a part of our anxiety because we fear that we will not be able to convey a message properly, that we won't be able to communicate properly. So the practice helps us control that anxiety of communication.
Good one.
Okay. So we have another question which is very common, like, can my child with autism attend school?
Definitely, you have to answer this.
Many people ask.
Absolutely, absolutely. A child with autism can attend school. That being said, a lot of autistic children need support and accommodations to feel comfortable in school. Um, I went to a normal school. I was not diagnosed with autism as a child. I had a really, really hard time in school because of sensory issues. Because I was not good at sports, I had a lot of motor coordination issues. I was not good with social communication, so I was always a loner. I felt very uncomfortable interacting with other children, especially in groups, because I did not understand group dynamics. I could not sit in one place for a long time. I found it very, very hard. So, these are all challenges that an autistic child will face in school. And so it is good to have a truly inclusive school, a school which gives that support, gives those accommodations to the child, because without that, the child is going to struggle, you know. He's going to have a hard time sitting in school. But if not a mainstream or an inclusive school, the child can always go to a special school. Uh, there is absolutely nothing wrong in sending your child to a special school if the special school is able to give your child the support that he or she needs. That is the main thing.
Preeti, that was an exceptionally intimate story that you shared. In the
Yeah.
sense, not everyone can say that with that much of authority because you've gone through it. And this is something we also fear as professionals in sort of branding a child and then sending them to a special school when they might have exceptional abilities to stick on to a mainstream school. But what happens is that as soon as the label is given, parents start to think about, does my child have to go to a special school? Not always.
Hmm.
Provided if we have a very clear learning plan, individual educational plan, which the school got to implement on an annual basis or at least on a quarterly basis, where they know these are the strengths of the child. And these are the difficulties. And cater, work on the strengths and find ways to go around the difficulties. And that's what should be a part of the individual education plan. I don't think such a thing exists in India, which fortunately we have, well, they had in UK, which now I'm in India. And second thing is that it is something that's doable. It's not very expensive. It's just having a documentation of one's progress in learning. And if you feel that these are the things that needs to be addressed in the next 6 months or next 4 months, that's on a 4 monthly basis, then that should be the main domain that should be focused upon, and the rest carries on as such. Because that will, if say if all go parallelly and one sticks behind, then you know this needs to be worked upon so that it catches up with the rest, and then you carry on. There must be some reason why that particular domain has been held back. And then we also look into another thing which I find schools do not do is if there is a behavioral problem, they do not assess the functional behavioral assessment, looking at the antecedent that led to the behavior and what led to the what consequence the child expected and the school gave. Very often they are served a litany of misbehaviors. Your child did this, did this, did this, did this, did this. What benefit does that serve other than developing hatred to your own children? So, school teachers are exceptionally good in making their parents hate their children because they don't know where to send this child after that. And they sent a
Yeah.
list of things that the child is so wicked about. So, if the school starts to do this functional behavior assessment, I think it's a right of every mother, every parent to ask their school to write what happened just before that and what happened as behavior that they're describing without giving he was a terrible, wicked boy. That doesn't help. What did he do? And what did the school do following that? Like I said, if the child is sent to the head teacher's office, he'll piss in the class every day because that's his way. He knows that's his ticket to go out of this noisy system. I'm talking about behaviors which might not be, you don't teach behavior in school. You are taught behavior in a way by being there, and by being there you learn that you have to communicate appropriately, you have to apply your interpersonal skills properly so that you establish relationship with other kids, and that's never taught. But there are some social modeling is done. There are some, I won't call it autistic club, they call it like clubs in such schools where there are children from all different classes attending there, like a little club before the school time starts or after school hours, so that they are taught some social skills where they're made to say statements like in a drama. You're expressing someone else's emotions, and every child is given an opportunity to do that, and others comment on it without being critical. And when that's done, they learn to hold a script in their head, which they may or may not employ in their later life. So, in a way, it relates to your emotions. So, quite a few things which I've observed, and I found that's quite useful, easily doable in India. I've got also many other ideas which perhaps have not been employed. We'll try to employ it later on.
Okay, it's very great to tell that some schools are accepting kind of autistic. Other cases also see cerebral palsy. Like, and I heard in Kochi there is a school choice who is accepting at least one child in a class to be in an abnormal way or else and having a disability, where they create to them to have a kind of vision that it should be held together, not outside actually. So it is very good to hear those kind of things. So we'll
I
go with
think
the last question.
in schools they have a stipulation that you should have a SENCO, special educational needs coordinating teacher. I believe so. Is that, does that happen across the board? Does all schools do all have them? I'm not. I'm new to this place. That I'm asking.
The ground reality is very, very
Very tough.
different from what schools are supposed to do.
Oh,
On paper, we have all these policies, but it does not happen
Not working out.
in reality.
so that's what we should be working towards.
Like I think that
Yeah.
is because of lack of awareness. Like a lot of people think that they hurt people, autism people, because there are cases like mild, severe, moderate, and level there, right? So there are severe, moderate cases or mild cases which they don't hurt people, or else they won't harm in students actually. So where they can be sent to these normal schools actually. It is very interesting to know that society, not interesting, very awkward to say that the society is not accepting those people. They comes in the second day and say that these people, even though they didn't hurt the child, also they will come up and say that this autistic child have hurt my child, and
Um,
in that way. So I'll go to the last question of the day, where Siddhara J have asked, my son who has a strong interest in cars, whenever he sees one, he runs outside to observe it. His teachers have expressed frustration with his behavior. So this
Can
question,
can he be allowed? My son is extremely interested in cars. You know, he's been
I think we
fascinated
have
with
covered
cars since he was 4 years old. Yeah. Um,
that.
so what
Still
I
blogging.
yeah, he has a blog. So what I used to do with my son, because he did not do anything without a car with him, so I had taken permission from the teacher and the school for him to carry a small toy car with him to school at all times. He would look at that, he would play with that. You know, he was allowed to do that. So these are the kind of accommodations that I was talking about. This is not something that is disturbing the other children, it's not harming anybody, but it helped him sit in school, it helped him sit in class, it helped him focus. So maybe, you know, you can try something like that, so that he doesn't run outside to observe the car, because he has his own toy car with him.
Um,
Okay.
I,
So I think it is getting to time.
Doctor, any suggestions?
no, I just thought that it can be very effectively used in certain, because he's so fascinated by cars. It can be used
Yeah,
in conditions like when you have this emotional barometer. I have used what they're so fixated upon as a measure of their increase in anxiety. And so it will be a car like that, angling going up. So they understand where they stand. So it's very easy
yeah.
to use it.
No, it is. I mean, you can use a special interest in so many ways. You know, it's
Yeah.
like the best leverage you can have. I have taught my son almost. I mean, so many concepts using his interest in cars.
That's what I'm saying.
So
Yeah.
many. You know, I've taught him language. I've taught him maths. I've taught
There
him
you go.
ADLs. I've taught him to sleep on his own. Like potty training, everything. Cars and cars. We were
Potty
like
training in a car.
potty training with cars. The cars used to go to the potty.
Okay. I hope
The
you'll teach
cars
him.
would do everything, you know. So when he was a
Yeah.
child, the cars would do everything. They were the, you know, role models.
One gets his
They
bowels to
would go
move.
to the Yeah, they would go to the potty. So he's like, oh, I need to go to the potty now. You know, like my car had gone in the morning.
So
He
again,
would.
I spoke about timetables earlier, the visual timetables. I think if you were to add something like, because it's well known that children with autism have constipation, majority of them have,
Yeah,
because they don't like the
yeah,
feel of stools going out, so they hold it back, and if at all it becomes dry and it cracks the skin there, then the pain leads them to further withhold stools. So what I do in
yeah.
this timetable, I add on the picture of potty, sitting on the potty before going to school and after coming to school. And because they're so hung up on that chart, they follow that with a religious fervor, and the problem is
Yeah.
clear. Everything can be used effectively. It's just how you use it more imaginatively, which sadly people with autism lack. Yeah.
Okay, so I think we are back in time to wind up the session, and
Yes.
it was a great talking with Setu sir, Dr. Setu sir, and Preeti Dikshit, where they have given a wide kind of ideas as well as eye-opening to a lot of people who doesn't knows about autism, and I wish I should conclude it by saying this actually, because I was not in this field for many years and never know about it. Once I came to know about it, Ashunians also, it is very kind of enthusiasm, or else you can say a kind of emotional touch where I don't want an empathy in that actually, because the people with the autistic or else the autism mother doesn't want empathy forward on them actually. So it's actually they want a kind of empowerment or else an awareness to the society, where this kind of behavior or else this autism is not a big deal, is not, because we need to educate a lot of parents or a lot of people who, I think even in my center, once people come us and diagnose us an autistic, they'll be like, they don't know, they start crying or else they swap, they don't know what to do next. So where I take up the class for them, that saying that this is not a matter for them actually. There are people who is having cerebral palsy or else many kind of other disorders, hyperactivity. So where they lead to a kind of a very difficult situation there to strive on. So this is like very simple if it is trained properly, where it kind of instructions or a kind of treatments, so it can be up to an extent it can be cured, not completely, where doctor says it's completely not cured. So autism is not kind of a, people who need to be completely separated, because I can take Preeti as a big example, like I should salute her actually, because I think last 4 years before you have diagnosed as autistic, right? So
No, I was diagnosed last year
last year. So
at the
I
age
think
of 45.
at the age of 45, this 44 years, she was living as a legend where she doesn't have any problems, or else the society never mentioned that she's having an autism. So it is
They
a very
mentioned me
evident.
having other things, Sinan.
Other things, okay. So
Yes,
but
yes.
still you went to school, you went to college, you went, had a
Yeah.
society, had you had mingled with a lot of people, so went to parties, you attended wedding, everything is there. So this is a kind of
Including my
clear.
own wedding.
Exactly, exactly. So that is, it is like you are training yourself. Might have not done a therapy, but still you have
Yeah.
trained yourself, or your parents have given in a such a way that you can be controlled in yourself. So this is very evident to the society, that we can say that it is not that it is a completely a thoughtful process it's running on, where doctor says how we take it us, how we nurture the society. So this is the thing we were in this autism month, we were also looking out for, where the people should be educated what is this autism about, and this is not a big deal or end of the world, nothing like that, because the upcoming generation we can see that a lot of autistic cases, where I think the survey which shows like 1 in 100 has autism. So it is very difficult to accept in the society. So I want this to be accepted society, where people take it as a very light thing, but give a proper treatment for that. So I think by saying this, we are ending up the session. It was a nice pleasure evening with you guys, and thanks for attending my invite. Thank you so much, and we can see you all together another day, another
Thank
event.
you,
Thank you
Sinan.
so much.
Thank you, doctor.
Thank you.